Hundreds of healthcare workers in central Vermont took to the streets this afternoon, many waving signs condemning the University of Vermont Health Network. This comes after the group announced plans to cut several healthcare services about a week ago. Staff want them to reverse course. ABC 22's Matt Holderman was at one of the demonstrations this afternoon, and he joins us now live in the newsroom. Matt?
That's right, Lauren. The bigger of two protests happened at the Central Vermont Medical Center in Berlin today, with the other one happening at the Mad River Valley Health Center in Waitsfield. They are two locations that would see significant or even complete service cuts under UVM Health Network's plan, and medical staff say their leaders are making the wrong choice. This was the scene outside Central Vermont Medical Center Thursday afternoon. Dozens of doctors, nurses, and healthcare experts taking a stand against their network's leadership.
The places they've chose to suggest that they want to cut are not, it's just not sufficient. It's not okay, and it shouldn't be happening in those departments.
Last Thursday, the University of Vermont Health Network's top officials released their current idea on how to save money in the coming budget year, after the Green Mountain Care Board found they were $80 million over budget in fiscal year 2023. But to the dismay of many, the new plan mainly consists of closing certain departments and clinics around the state. Here at CVMC, the network plans to shutter the hospital's inpatient psychiatric unit, and in Waitsfield, they want to completely close the Mad River Valley Health Center, which includes family medicine and rehab clinics.
There's so many areas where the network really needs to reconsider the choices that they've made and make them elsewhere, not for the most vulnerable populations.
CVMC workers argue their psychiatric unit is essential, and to close it would be a major disservice to the community, especially during a time where mental health needs are high.
We see people almost daily in our emergency room that suffer with mental health issues that need some help. I don't think it's a smart move. Inpatient psychiatry, there's not anything else around for folks.
Now, UVM Health Network President and CEO Dr. Sunny Eapen released a statement last week along with the announcement of the planned cuts. He says, in part, quote, "These decisions we are being forced to make are painful because there are patients connected to each one of them. I apologize to our patients and to our employee colleagues who will be impacted." And another message the workers really wanted to get out there today was that the network's plans are not yet set in stone. They think leaders can reconsider the areas where they're making cuts and find different ways to save money. The network has not yet responded to today's demonstrations. Live in the newsroom, Matt Holderman, ABC 22 News.